In this video, Kenzie and I are going to show you some tips and techniques to try to treat your ulnar tunnel syndrome. And that's pain right on the inside of the wrist right here. It may radiate down your forearm. It may come into the fourth and fifth digits of your hand. And what that is that's going to be nerve compression of the ulnar nerve here at Guerrero's canal at the wrist. So that nerve does not pass through the carpal tunnel. The only nerve that goes through the carpal tunnel is the median nerve. So the ulnar nerve and radial nerve pass outside the carpal tunnel. But for this video, we're going to be discussing the ulnar nerve as it passes through Guerrero's canal. So the first technique that we're going to do is going to be a little soft tissue mobilization using some of these scraping tools or gua sha tools. So I got this set. It's pretty inexpensive. It comes with a scraping tool and then one that has rollers on it. So I'm going to go over here on this ulnar side over here, and I'm going to lightly scrape, or think about maybe even like shading over this area. I might stay off of that wrist area that's very sensitive and go into the palm on her pinky finger side of her palm. Maybe go all over the palm, come back up. I can use a roller, and I can do all this with or without lotion. It's just preference. I can go all over the entire area. So what I'm trying to do is kind of provide that kinesthetic awareness, decrease some of that, hypersensitivity and increase muscle tone that she's having. And then I'm going to flip her over here. I'm going to go through just some passive stretches. I'm going to stretch here. Maybe I take her fourth and fifth digit and I pull them back a little extra. I can do joint mobilization. So if you have someone that can do this for you, they're going to grip on the wrist on the hand side and then the wrist on the forearm side. I'm kind of pulling apart here. And so if you don't have someone, you can just take your own wrist and pull apart here and just give that what's called joint approximation and distraction. So pulling apart, you can even push in, and that's going to be some of that approximation. So pushing in and out, just some of that joint mobilization helps to desensitize the area, especially when nerve irritation is involved. And now Kenzie's going to demonstrate a little nerve flossing. So she's just going to kind of go out, straighten out the elbow, because we know this nerve passes behind the elbow here. It goes through the wrist right here in that canal and then out into the pinky finger side of the palm and fingers. And so there's a lot of variations of this. You can incorporate the neck and the shoulder and everything, but this is just a really easy one to do just throughout the day. And then so Kenzie also can just passively stretch herself, and she's going to take that fourth and fifth digit and pull it back a little farther. Now initially, if this is too much, too aggressive, don't pull it as far. Be easy with it initially and then progress to going farther with it. Now going into some strengthening exercises. So anytime that I have an injury or an irritation in the hand or wrist, I like to do kind of global strengthening in this area. So she's going to demonstrate with a dumbbell here, wrist extension. So she's going through 2 to 3 sets of 10 to 12 repetitions. She's going to repeat this once a day. You can take a towel roll, prop the wrist up, if you don't have some sort of wedge. Now she's going to go into wrist flexion. Again, 2 to 3 sets, 10 to 12 repetitions. And then she's going to go radial deviation, almost like you're hammering a nail there. Same kind of thing, 2 to 3 sets, 10 to 12 reps. And now she's going to take this band and she's going to perform ulnar deviation. So she's pulling her wrist so that her little finger comes towards the forearm. Another variation of this is she can hold it at the top and kind of pull down. So you can do both ways with that. If this is really irritated, especially with that nerve right there, you can avoid this one initially. And it's okay for it to be some painful, have some irritation there. That's not uncommon, but just you want to be cautious initially not to over irritate. Now she's going into some finger extension here with the extension band. So she's just pulling her fingers apart and just going through that 2 to 3 sets, 10 to 12 repetitions, working all these wrist and finger extensors here. She can bring her wrists into extension while she does that. So a lot of variations with that. And we're going to go over now to a hand gripper or hand strengthening exercise. 2 to 3 sets, 10 to 12 repetitions. Interesting fact about the hand with grip strength, most of the power in the grip in our hand comes from the pinky finger or ulnar side here, that was also known as a hypothenar eminence. That's where the power of our hand comes from. We use our thumb, index, and middle finger for more fine motor coordination, in-hand manipulation, and dexterity tasks. So strengthening this bottom portion is very important, because you may also notice when you have irritation with the nerve in this area, you may be dropping things, difficulty holding on to items. And so now she's going to do, we're going to do tip to tip or prehension strengthening here. And she's just squeezing this. You can use a whole bunch of different things with this. They make all sorts of, hand strengthening balls and different bands, all these different things for this. So she's going to do that, and then she's going to take 2 fingers on top. Now we're doing what's called tripod or 3-jaw chuck or whatever you want to term it as. 2 to 3 sets, 10 to 12 reps on all of these. And now we're going to do lateral or key pinch. So the thumb's on top and she's kind of pinching down like that. 2 to 3 sets, 10 to 12 reps. Initially, first week, maybe even 2 weeks, maybe she only does 1 set of all of these things so as not to over irritate. And then she progresses. First week, do 1 set of all of them. Second week, do 2 sets. Third week, now we're progressing up to 3 sets of each one of these. Anytime that I have a nerve condition, I like to also incorporate some kinesiology taping. So what I'm going to do is take a little kinesiology tape here. Now, as far as positioning and how much tension to pull, I'm not really keeping up with any of that. I just want to put this over the wrist, and then I'm going to kind of flatten it down here and go over the general area of her forearm. Try not to wrinkle this. And I got a little wrinkle on that, but that's okay for our purposes for the video. And just put it over this just to give a little bit of that kinesthetic awareness to the nerve. So while she moves, goes throughout the day, we just have that little bit of additional sensory input there. For a lot of patients, you'd be surprised how well that really helps control their pain. Again, it's not so much for stability or anything like that. It's just putting it on there to provide that kinesthetic awareness. Now, the last 2 things that we need to talk about is going to be using a brace. There are braces that you can buy, pretty inexpensive. You're going to put on this side of the wrist and the finger that you use typically at night to sleep, so that you're not compressing the nerve going this way or you're not overstretching the nerve. Just something to sleep in every night. Those do really well, especially if you're traveling, you're going to be riding in a vehicle for very long. You can wear that on your wrist or hand. It works well. And the other thing is going to be activity modification. So when this becomes irritated, a lot of times people are using a keyboard or something, they're propping their wrist up, or maybe they're holding onto something and grasping it throughout the day. So you just want to modify that, change up how you're doing it, switch to the other hand if possible, just to try to take some pressure off of that irritated area. You'd be surprised, a lot of times just modifying the movements that you're doing and the use that you're having of that particular area or hand, it does really well, and these symptoms usually resolve on their own. But if not, we provided the video for you to give you some help at home. As always, thanks so much for watching, and I hope this video helps.